So I think we'll make a start. So hello everyone, and thank you for joining us this afternoon to learn more about the development of the rapid involvement of patients and the public in evidence synthesis framework, or RIPPLES for short. My name's Eugenie Evelyn Johnson, and I'm a research assistant in evidence synthesis working at the NIHR Innovation Observatory in Newcastle in the UK. And I'm also joined for this session today by some of the members of the research team on screen, who you'll get to know a bit more shortly. Before we begin, these are our acknowledgements and disclosures. So the NIHR Innovation Observatory is funded by the National Institute for Research. The views expressed are those of the authors, not necessarily those of the NIHR or the Department of Health and Social Care. And just a small amount of housekeeping. We're recording today's session and we're going to be posting it on the NIHR Innovation Observatory YouTube channel. However, we'll only be posting an edited version of the session on YouTube that only contains the presentation. Please keep your microphone on mute and camera off during the presentation. And if you'd like to ask a question at any point, please use the Q&A function with Teams. Before we start, I wanted to give a quick introduction to the core team who worked on developing the framework. So alongside myself, I'm pleased to welcome Sean. Sean, would you like to say hello?
Afternoon, everyone. Great to see so many people here today. My name's Sean, and I'm also a research assistant at the Innovation Observatory.
Hey, Sean. We also have Debbie.
Good afternoon. My name's Debbie Smith, and I'm a public research team member.
And Maddie.
Hi everyone, I'm Maddie, one of the research assistants at the NIHR Innovation Observatory.
And Daisy.
Hi everyone, I'm Daisy and I'm an analyst.
And part of our team, we also had Rebecca Harmston, who alongside Debbie was another one of our public research team members, who unfortunately couldn't make it to most of today, but her insights were invaluable. We had the support of Jane McDermott, who is Professor of Inclusive Engagement at the NIHR Innovation Observatory. And we'd like to give some thanks to Fiona Pearson, who alongside myself conceptualized the idea for the framework initially, and Dr. Nick Meader for his support, and Jen Taylor, who's with us here today, who's been helping us to put together web materials and is helping with technical support for. We'd also like to thank everyone who filled in our survey and came to our workshops, and we'll touch more on that soon. And today we're also joined by Chris from the creative agency Nifty Fox, who's doing some live scribing of the event, and we'll see what he has produced later in the session. So just to give a bit of an overview of the plan for the rest of this session, we're going to tell you a bit more about why we developed the RIPPLES framework, as well as how we developed the framework, alongside the people who will use it most. And then we'll give a short introduction to the framework itself and various members of the team. We'll tell you a bit about the next steps for the framework, and we'll also hopefully have a little bit of time for some Q&A as well before we come to a close. So first, why and how we created the RIPPLES framework. So quite a few of you here today will probably already know this, but I wanted to start by talking a little bit about what evidence synthesis is using an example. So let's imagine you're trying to think about which of two different medications may work better for treating a health condition. So just as an example, let's say you want to know what medication works best for helping to reduce the symptoms of asthma. So if you look around at academic papers, you might find several clinical trials looking at how well one medicine works compared with not taking any treatments at all. But you might also find a number of clinical trials looking at how well another medicine works compared with not taking any treatments at all. When we have lots of these different research papers, how can we best make evidence-based decisions about our health and care? This is where evidence synthesis comes in. So evidence synthesis is a way of bringing together as much evidence as possible on a particular topic to find out what it says as a whole. It usually involves a series of defined steps, including looking for studies that are relevant to a research question, taking relevant information from those studies, assessing their overall quality, and sometimes referred to as assessing how much bias there is in those studies, bringing together what the evidence says as a whole, and interpreting and making conclusions about that evidence. And evidence synthesis can help us answer a range of different questions in health and social care, and they cover the spectrum of health conditions. So some questions that could be answered with evidence synthesis include what treatments work best for a specific condition, what diagnostic tests are most accurate at detecting condition, and what are people's experiences of living with a condition or using a particular treatment. But then what is rapid evidence synthesis? Well, the clue is in the name. So they're often commissioned to help inform policy decisions, especially in time-sensitive situations. A good example of this was during the COVID-19 pandemic. And this helps policymakers to make decisions more quickly. Often the process of a rapid review or rapid evidence synthesis is shortened either by simplifying the methods or taking some of them out, and it can often take between a few weeks and a few months. In terms of what we already know about involving patients and the public in evidence synthesis, there's already tools and guidance out there to help researchers embed patient and public involvement, or PPI, into their work. This includes resources such as briefing notes from the NIHR, the UK Standards for Public Involvement, and a tool called the Active Framework, which was specifically designed to help researchers embed PPI into a type of evidence synthesis called a systematic review. But we know that for rapid evidence synthesis, researchers are sometimes completing their work in a few months or even a few weeks, and this has been our experience as well. So we wanted to create a framework specifically to help researchers who are doing rapid evidence synthesis embed meaningful patient and public in their work. We wanted to take shared learnings from those who are involved in doing rapid evidence syntheses, as well as members of the public, to create a tool that could help facilitate valuable and meaningful PPI in rapid evidence synthesis in ways that were viable within project parameters. This is why we set out to co-develop Ripples. So before the team take us through an overview of Ripples itself, I wanted to talk just a little bit more about the process we went through to co-develop the framework. So we started the development of Ripples in June 2024, and we started by looking for and analysing what current frameworks for patient and public involvement are already published and available to see what the most common features are. And we included 53 frameworks in total in this work, and this helped us to identify common features, but also potential gaps in current knowledge where we needed to find out more from the people who'll be using these frameworks in the future. We also ran a survey to ask people, including researchers in the area, members of the public, policymakers, and others, what they thought would be the most important considerations for how we do PPI in rapid evidence synthesis. We had 101 responses that informed the development of the framework. Finally, we ran 2 online workshops with researchers, members of the public, PPI professionals, and policymakers to further develop what should be included in the framework. So in our first workshop that happened in November of last year, we had 15 people attend, and we talked about how best we can find and in rapid evidence synthesis. And in January of this year, we held a second workshop where we presented our initial draft of the framework based on all of the previous steps. There, 16 people attended, and they helped us to further refine what Ripples will be looking at, what you will see today. We also think it's really important to note that we set out to listen to the needs of people who might use the Ripples framework in future. That not only includes researchers, but also members of the public, PPI professionals, and policymakers. And we wanted to try and ensure that we were co-developing the framework as much as possible to meet that aim. So firstly, we're really grateful for the input of Debbie and Rebecca, the members of the public who've had an important role in steering the project from its start. They've been giving their perspectives and ideas on everything from inputting on actions and the direction of meetings to feeding into the different components of the work and the facilitation of this session, which you'll see soon. We also had feedback from members of the Innovation Observatory's public advisory group at the start of the project and throughout the workshops, and that helped us shape the framework. And as previously mentioned, we couldn't have developed the framework without everyone who filled in the survey and attended the workshops, helping us to really understand what it is people wanted from the framework and what would be most useful to them. So in our first workshop, we talked about perspectives on how we can find and involve people in rapid evidence synthesis. And then in our second workshop, we presented the initial draft of the framework based on all the previous steps. So an example of how that really helped us to define and redefine the framework is that the very initial version that we took to workshop 2 looks incredibly different to the version of the framework that you're going to see today. We presented the initial draft of the framework that we'd made at workshop 2, and based on the feedback, we quite literally had to go back to the drawing board to redesign it in response to what people would find most useful and what they felt best reflected how patient and public involvement should work within rapid evidence synthesis. So this element of co-development was not only a really huge influence on the content of the framework and the type of resources we developed for it so far, but it's actually also influenced the name, because people who attended the second workshop voted for the name Ripples as their favorite at the end of that session. So without further ado, I'm going to hand over to Sean, who's going to give us our first introduction to the Ripples framework. Sean.
Thanks, Eugenie. So yeah, we're all really excited to be able to share Ripples with you today. It's been a long time in the making. So without further ado, we'll dive right in. And as with all Ripples, we'll start in the center and work our way out. So our center point for this framework are our underpinning values that will inform every interaction we have with members of the public or with patients. And for us, these are set out in the UK Standards for Public Involvement. So Debbie will speak a little bit more in depth about those shortly. And then if we move out to our next layer, we've got ongoing facilitators that are not linked to any particular rapid evidence synthesis project, but are tasks and values that we have going on concurrently that'll facilitate being in contact with the right people and having the right systems and networks set up to have people involved in rapid evidence synthesis projects when they begin. Which brings us to our final layer, which is how we bring all of this together into one cohesive unit and we implement that into a particular project with a particular question. Now you may be looking at this and going, that all looks well and good, but actually that's an awful lot of information in quite a small diagram. We completely agree, which is why we've created some very in-depth guidance documents as well as a project-specific worksheet, which is all available when you download the Ripples framework. And hopefully working through those and reading through those will facilitate you getting your hands on Ripples and getting involved with it yourself. So I will pass over to Debbie now, who's going to talk us through the UK Standards for Public Involvement.
Thank you, Sean. I'm Debbie Smith, and I've been involved in the development of Ripples from its inception as a public member of the development group with my colleague Rebecca, and as I say, really involved in every aspect of the project's development. In relation to the Ripples resource now, I'm going to talk about the 6 UK standards for public involvement in research, which, as Sean said, are outlined in the UK Standards for Public Involvement document. And this was developed by the National Institute for Health and Care Research. These standards were originally developed to provide a framework for how the public can be effectively involved in research to ensure that their voices and experience are integrated into the process. So as a Ripples development team, we felt the standards provided us with a strong, tried and tested foundation on which to base our framework. So really, why reinvent the wheel? So I'm going to outline each of the 6 standards very briefly, what the standard is, and then provide a very brief reflection on them. So the first one, communication. This is about the use of plain language for well-timed and relevant communications as part of involvement plans and activities. Open, honest and clear communication should be maintained between those leading the rapid synthesis and the public. And I think this is important because it ensures that participants really understand the process, their role in it, and how their contribution is going to be used. The second one, working together. Work together in a way that values all contributions and that builds and sustains mutually respectful and productive relationships. The involvement of the public should be meaningful and valuable, Those undertaking a rapid synthesis are encouraged to recognise and respect contributions made by the public, making sure their input positively influences the process and outcomes, and indeed that is recognised. So Ripples also highlights the importance of setting expectations of the public involvement and, to be honest, being open in advance about particularly considering the time constraints of such a project. The third standard is around inclusive opportunities. This is about offering public involvement opportunities that are accessible and that reach people and groups according to research needs. So any rapid synthesis should involve a diverse range of people representing the community and those who are affected by the particular topic. This ensures that perspectives of different groups are heard and considered, more importantly implemented, which leads nicely onto the impact standard. So seek improvement by identifying and sharing the difference the public involvement makes to the research. The involvement of the public should have a tangible impact on the final output from the rapid synthesis, so influencing decisions from planning and interpreting results through to dissemination. It's important that those taking part need to measure and reflect on the impact of the involvement of the public on their work. Fifth one is around governance. Involve the public in research, management, regulation, leadership and decision making. Public involvement in governance can help the rapid synthesis process to be more transparent, and this leads to a more public trust in the final results. The final standard is about support and learning, and it states offer and promote support and learning opportunities to build confidence and skills for public involvement in research. So people involved in any rapid synthesis should receive the necessary support and training to help them to contribute effectively. This can include access to information, training, and any other resources needed to help make participation easier and more effective. And therefore, in the Ripples guidance documents, we've suggested ways that this can happen. So, in fact, the very nature of me being here shows that my involvement in Ripples development is actually an example of the standards being put into practice. But carrying this forward, these standards help to us ensure that public involvement is genuine, equitable, and impactful throughout a rapid synthesis. So, thank you. I'll hand back to Sean now.
Thanks, Debbie. That was great. So, as I say, the next level of our framework is our ongoing facilitators. So, as you can imagine, with a rapid evidence synthesis project, often you simply don't have the time to put all of these steps in place in a high quality manner before your project's over. You probably can't even get halfway through a lot of the time. So these are ongoing tasks and ongoing ideals that we bring forward throughout the entirety of the network, the research team, the institution, and it fosters that environment and facilitates us being able to involve members of the public when a project becomes available. So we'll start at the top with fostering ongoing relationships with communities and networks. So this ongoing communication enables us to build trust between the research team, within the institute, and the communities and networks that you're involved with. What those networks and communities are may be different between teams, it might be different between different institutions. So it could be charities, it could be patient advocacy groups, it could be local communities, it could be more national, all depends on what your particular field of study is. But it also allows us to build that genuine intention. So we want them involved in research because we know that's how we get the best possible research, and that in turn becomes the best health outcomes for people ultimately. Having the lines of communication already established saves you so much time when it comes to sharing opportunities to be involved in a project. And it also allows for that two-way communication, so you know what networks are keyed into particular conditions, for example, or particular topics. And there's a wide range of resources available on different guidances and advice for how you may engage with these communities, from that initial communication and introducing yourself through to maintaining that ongoing collaboration. So, for example, the Applied Research Collaborative Northeast and North Cumbria have got a very good guidance document that we will share as part of the guidance. And if we move on to training and support for researchers, the fact that everyone showed up today, I think, highlights how important we feel that having public voices in rapid evidence is. But it can be quite often intimidating. It can be quite time consuming for research teams to implement this. So being able to have that training and support not only builds the capacity and confidence for researchers, but also helps to foster that environment throughout a team or an institution that this is something that is of value, it's something that is expected of projects. And similarly, that also goes for the training and support for members of the public as well. The capacity and confidence side of things is just as true for public contributors as it is for members of the research team. It also helps us to build trust and also establishes a two-way support mechanism whereby they're feeding into the research, but also we're making sure that they are not disadvantaged in any way, that they feel confident, that their contributions will be of value, and that they are able to contribute to the maximum effect they possibly can. And again, there's a wide range of resources available online for training and support, both for members of the public and for research teams. For example, the NIHR Learning and Involvement team and the Cochrane team have both produced very useful guidance on that. And then finally, for this level, we've got establishing reimbursement mechanisms. So we always want to make sure that no one is disadvantaged through being part of a research project, but that can often take many different forms. Different people may ask for different forms of reimbursement, and it's important to know what your options are so that we can work together with that open dialogue and communication we've established to be flexible to the needs of people who are contributing to the research. And ultimately, having these established before you start a research project can save you so much time. And when time is such an essence in a rapid project, it can honestly be the difference between getting things sorted and getting everything finished on time and things dragging on for months longer than they're supposed to. So I will pass over to Daisy. I believe you're taking the next topic.
Thanks, Sean. So just to reiterate that the Ripples worksheet can be used to help plan and carry out patient and public involvement, and that has a lot more detailed information on. So I'm going to go through the outer layer, and this focuses on how PPI can be embedded within the steps of rapid evidence synthesis and building on the foundations of the inner layers. So just to take some of the key points, that you need to consider the needs of the project and identify who you need to engage with. So is there any specific characteristics such as age? Use a variety of communication avenues to maximize range, so both online and physical materials. For more specific groups, it can be useful to search for condition or demographic specific groups, so things like charity organisations. And snowballing and encouraging the sharing of opportunities between individuals can be effective. So then if we look at planning the review, the planning stage can often be a good point for public involvement in the project, as their input can be used to underpin later stages of the work. So we suggest to take on board the individual projects. So you might be limited in terms of the remit of funders or stakeholders, which I'll discuss in a moment. But again, some key terms is to remember transparency. So really be clear with what can be input into and what is already defined. We suggest using a draft of the scope as a starting point, and invite contributors to comment on any sections that they feel are missing or that could be improved or amended, and use these comments to identify what is feasible within the project and how any suggestions can be implemented. A similar approach can often work well for discussing the methods, but that is dependent on the familiarity of the public contributors with the methods. So again, as Sean was saying, it's good to be able to provide further guidance through training and support. And then in terms to then just go over, so commission reviews. So we do have more information within the guidance and the worksheets for suggestions to guide discussions with key stakeholders. Because with commission reviews, you often have a predefined research question and scope, and the challenge that comes from this is being able to meaningfully involve patients and the publics in defining the parameters of the work. So the main thing we suggest here is trying to have a discussion with stakeholders, whether patients and the public were involved in defining the question or the scope and how this was done, if so. And the answers to these questions should be noted and used to inform the methods and discussion section of any reports or publications. So then to go on to expand on this a bit, the involvement doesn't have to end at the planning stage. So some public members may like to continue their involvement within the project. So again, the worksheet contains a section to help plan whether or not public contributors will be involved in parts of the rapid evidence synthesis beyond the planning and interpretation stages. So if there is a scope for future involvement, for instance, in the screening stages or output writing or dissemination, it's essential to ensure that the opportunity is presented clearly to potential public contributors. To expand on that any expectations of involvement are discussed and agreed, and we do recommend that this should be a discussion so that public members have the opportunity to ask questions and that they feel empowered to do so. So then to look at the rapid evidence synthesis, wherever possible, patients and the public should be involved in sense checking and interpreting the overall findings when presenting the results. Plain language and should be used, and any terms should be explained where required. Questions should be tailored to suit the overall research question and the aims of the evidence synthesis. And if you are considering involving people in other stages, and you can consider involving people in other stages of the process, if time and capacity allow. And if you are involving people in other stages of the process, again, to ensure that potential involvement is discussed and the expectations around the involvement is discussed. Again, to facilitate quicker interpretation within the time constraints, you can focus on areas of the results that are most important to your research question. So then to finish off, impact and sharing. So this can be felt at all stages of the research project, from identifying and clarifying a research question through to dissemination. It's important to provide regular plain language and accessible updates on progress and results to all involved. The impact should be reported as a standard part of the dissemination process, and there is some guidance out there that can help you in this. So there is the Public Involvement Impact Assessment Framework and public involvement in research impact toolkit, which can suggest ways to measure the impact. And then the GRIP2 checklist can help reporting on the impact of public contributors on the work.
Thank you so much, Sean, Debbie, Daisy, for giving us that overview of the different layers of the Ripples framework. So Sean, Debbie and Daisy have gone through some of the key points of the framework quite quickly and in quite a high level. But as Sean mentioned earlier in the presentation, we also developed a couple of resources to help with implementing the framework within your own rapid evidence synthesis, which go into more depth. So the first of these is the Ripples guidance document, which goes through each of the layers and sections of the framework that you've just seen individually in the presentation. And it gives more structured guidance on how you could implement Ripples within your own work, as well as providing some pragmatic tips for each section. The guidance document also provides lots of useful links and references to other resources in each section that you might find helpful when planning or undertaking PPI for rapid evidence, as well as the parts of the framework that are about building relationships and skills. The second resource that we developed, as Daisy has previously mentioned, is the worksheet for researchers, which we found out from our workshops would be a really helpful resource when planning and conducting different rapid evidence syntheses. So we've designed it to be as easy to use as possible, with lots of questions that can be answered just by ticking boxes and by using bullet points to try and ensure that while there is a plan for patient and public involvement within a rapid evidence synthesis, but it's also quick and simple to use. So there's a section in the worksheet for each of the individual sections on the outer ring of the Ripple framework that Daisy previously went through. So that includes planning who will be involved and how they'll be engaged, a section specifically for commissioned reviews, if that happens to be what you're working on, and planning how people will be involved in the evidence syntheses and how the impact of patients and the public on the work will be captured and communicated. So now that we've introduced the Ripples framework, what's next? So Ripples is available to download now with the guidance document and worksheet for researchers included, and that's available on the NIHR Innovation Observatory website. It's completely free for anybody to download, and here's what the dedicated page looks like, where you can find out more about the framework and download the resources that we've just mentioned. Also included a QR code here to take you to the page that we've just shown you. But we don't want this to be the end of the story with Ripples. You heard earlier in the session that we wanted to ensure that we were making Ripples as useful to the people who use it as possible. And we try to co-develop the framework insofar as possible. And that's something that we want to continue doing going forward. So we have a few planned next steps for the Ripples framework to help us achieve that. So firstly, we are aware that the resources we've developed so far are aimed more towards researchers who are doing rapid evidence synthesis. We heard in our workshops that it would be useful to have additional materials that are more targeted towards patients and members of the public to help them understand more about what rapid evidence synthesis is and what the framework aims to achieve. So we want to go and work more with members of the public so that these new materials are accessible and engaging, and we hope to add these to the Ripples framework in the future. We also found out that people would find case studies on how people have used Ripples in their own context, a useful way of understanding how the framework is being used for different types of rapid evidence syntheses. As such, in time, and as Ripples is hopefully used more widely within the research community, we want to develop these case studies as a resource for people to reflect on. Finally, we want to evaluate who is using the Ripples framework, how they're using it, and get feedback on whether there are any elements of the framework and its guidance that could be improved, or to find out if anything is working particularly well. If you download the framework and its resources, you'll be asked if you'd be willing to be contacted in future to help us do this evaluation work.